What causes anxiety disorder? Anxiety disorders are common in people of all ages. They can range in severity from mild to debilitating. We do not fully understand the exact causes attributed to anxiety disorders. When a person has an anxiety disorder, they may feel fearful or uncertain almost all the time. According to the National Institute of Mental Health, the fear that occurred due to an anxiety disorder is markedly different from the brief episodes of anxiety that are commonly related to normal events, such as public speaking events. In most cases, the anxiety disorder symptoms persist for more than 6 months. There are several different types of anxiety disorders. Generalized anxiety disorder: person is constantly worried even if there is no real reason to worry about anything. Generalized anxiety disorder starts at teenage, and symptoms get worse as progress through adulthood. Panic disorder is often marked by extreme anxiety and feel panicked about small things, escalate during times of stress. Sadly, many people with panic disorders may struggle with embarrassment. They may feel embarrassed that simple tasks, such as driving a car or shopping for groceries, are difficult and sometimes impossible to do. Obsessive-compulsive disorder: a compulsive desire to repeat the same actions over and over again. In most cases, anxiety disorder symptoms associated with OCD appear during childhood. They clean their house obsessively or consistently or check their car door repeatedly after locking it. Phobias: intense and irrational fears of things that are not that dangerous. Symptoms include feelings of panic, elevated heart rate, shortness of breath and unexplained shaking. Social anxiety disorder is an afraid of being judged by others. The symptoms may be so devastating to disrupt relationships or even daily life. Typically, the onset of this disorder happens at age 13, and over 1/3 of the people who suffer from this disorder suffer from it for 10 or more years before seeking help. Post-traumatic stress disorder occurs after an accident and person is stressed even when there is no danger present. Recent research has shown that anxiety disorders may develop from a complex set of risk factors, including genetics, brain chemistry, personality, and life events. Just like genetic risks of heart disease or cancer, anxiety disorders can actually run in families. Studies have shown that they can at least partly be inherited from one or both parents. Severe or long-lasting stress can physically impact the brain's nerve cells. This interrupts circuits that transmit information from one region of the mind to another. People with anxiety disorders experience brain structure changes in certain areas that control memories linked with strong emotions. Brain chemistry imbalances are a very likely cause of anxiety disorders. They have issues with several neurotransmitters, brain chemicals, including serotonin, norepinephrine and gamma-aminobutyric acid, GABA. Serotonin, norepinephrine, and GABA also play a role in sleep, mood, and emotional stability. Environmental factors like trauma have the power to trigger an anxiety disorder in people who have an inherited susceptibility, despite not developing the disorder earlier. The mind can overcome anxiety by improving the flow of neurotransmitters in the brain. But in some cases, medicines designed to improve neurotransmitter regulation are required. Thank you.